issues we are debating are important ones that members feel deeply about. I understand that. While vigorous disagreement is part of the legislative process, members are reminded that we must adhere to established standards of decorum in debate. This is a reminder that it is a violation of House rules and the rules of this committee to engage in personalities regarding other members or to question the motives of a colleague. Remarks of that type are not permitted by the rules and are not in keeping with the best traditions of our committee. It's a very serious matter. The chair will enforce these rules of decorum at all times, and I urge all members to be mindful of their remarks today. If the chair finds the member to be in violation, the member will be suspended from speaking for the remainder of the proceedings. I now recognize myself for the purpose of making an opening statement. Good morning. Vaccines are a crucial public health tool which save millions of lives. As a physician myself, I've administered many doses of vaccines, especially COVID-19 vaccines. In 2020, I even volunteered to participate in the Moderna vaccine trials. Having this hearing is not an anti-vax hearing, and I am not anti-vax. I shouldn't even have to say that. But unfortunately, I do. I'm sure as I sit here, there are people getting ready to use that very pejorative to discredit this hearing. Unfortunately, in an era of sound bites and news cycle whiplash, it seems there is little time for nuanced conversation about these topics. Today, I hope we can have that nuanced conversation about process. Sometimes we don't know any weaknesses in a system until it is truly tested. Now is the time to safeguard for the future and about how we can do better next time if there are things we recognize that could have been done better. It's now a time to look at the things we did well as well. But we need to restore trust in public health in the process. I'm very concerned with the hesitancy by so many today to vaccinate their children. That's a grave concern of mine. Testifying before us today are two senior officials who lead the government's post-marketing vaccine safety systems. These systems are absolutely critical to keeping the American people safe, but also to earning and preserving their trust and the trust of the physicians that care for patients. Our witnesses will discuss how these systems work, what they can do, what they can't do, and the challenges that they face. That's a fair process. Their testimony is important to design better systems in the future as needed. One such system, the Vaccine Adverse Event Reporting System, or VAERS as it is well known, is perhaps the best known of these surveillance systems. VAERS has been the source of attention and controversy since the beginning of the COVID-19 vaccine rollout. However, concerns about these data are usually met with dismissive replies. Unfortunately, they often point to the fact that VAERS is unable to prove causality, and it contains reports of people being hit by a car after vaccination. They say that VAERS is being misused by anti-vaccine advocates and that it is misinformation. These are all legitimate concerns of the American people, especially. This seems to ignore many legitimate questions that have been raised. For example, how does the government utilize this data? We want to know. During her testimony before this committee last June, Director Walensky assured us that the CDC had a responsibility to comb through every single report to VAERS, if you will. It's unclear if that has happened or if that's true. People who have submitted reports to VAERS have told my staff that they were never contacted by CDC or FDA officials. A recent British medical journal investigation found this too. It seems that both sides agree that there's something wrong here. Further, while serious injuries caused by vaccines are rare, the government has assumed the responsibility to compensate for them. In doing so, vaccine manufacturers have been shielded from liability. Therefore, the government has an important duty. one that is essential in preserving trust in vaccines and how we message completely and honestly about them. Appearing before us today is Commander George Reed Grimes, Dr. Grimes. Dr. Grimes is HRSA's Director of Injury Compensation Programs and oversees the Countermeasures Injury Compensation Program, or CICP, as well as the Vaccine Injury Compensation Program, or VICP. Because COVID-19 vaccines were purchased and distributed by the federal government under the Public Readiness and Emergency Preparedness PrEP Act, they are covered under CICP, whereas most other widely distributed vaccines are covered under VICP. As of January 2024, CICP has compensated 11 claims out of the more than 12,000 that have been filed for COVID-19 vaccines. Because of its design, CIC payments are also significantly smaller than VICP, an average of about $3,700 compared with almost $500,000 in VICP. So it appears that CICP may not be designed or equipped to handle a vaccine that was so widely distributed and mandated for many as COVID-19 vaccines were. So I have concerns that we wouldn't be able to expect people to line up and get vaccinated during the next pandemic if they feel that in some way they're going to be abandoned. Again, this testimony is important in designing better systems for the future and establishing best practices. I hope this hearing will provide us with an opportunity to discuss what lessons were learned during the pandemic about our vaccine safety and surveillance systems. These lessons, I believe, are critical in preparing for future pandemics, which is the mission, one of the missions of this subcommittee. And I look forward to a robust and on-topic discussion about these issues. And I want to thank everyone for being here, especially our witnesses for being here. I would now like to recognize Ranking Member Ruiz for the purpose of making an opening statement.
Thank you, Mr. Chairman, and thank you to the witnesses for your participation in today's hearing. Our nation's vaccine safety systems play a critical role in protecting public health. Every day, scientists, physicians, and public health officials work together as part of this system to monitor the safety and efficacy of vaccines to ensure the best possible products reach everyday Americans. Their efforts have helped protect us from the threat of deadly diseases for decades. And their efforts during the COVID-19 pandemic helped contribute to one of the most successful vaccine rollouts in history, which under President Biden's leadership led to the country out of the depths of the pandemic. In total, these efforts saved 3.2 million lives, prevented 18.5 million hospitalizations, and saved the United States an estimated $1.15 trillion in medical costs. As a physician who went out into underserved communities to administer vaccines during the height of the pandemic, I saw firsthand the difference these vaccines made in helping our communities overcome COVID-19. So at the end of the day, we were able to save so many lives, prevent so much illness, and reduce a mountain of medical costs on our system because these vaccines were shown repeatedly to be safe and effective due to extensive clinical data. And since then, our nation's robust vaccine surveillance systems and countless other studies have only reaffirmed the safety of these vaccines by monitoring for and evaluating serious adverse events, which remain rare. This system has worked well. In fact, we saw it successfully identify safety signals in vaccines during the pandemic when it detected cases of thrombosis with thrombocytopenia syndrome, or TTS, associated with the Johnson & Johnson vaccine, resulting in the CDC and FDA releasing updated recommendations for vaccine products. So I do want to be clear that while adverse events are rare, they are not impossible. That is why we must continue to invest in a strong, capable vaccine safety and surveillance system that is efficient in ensuring the best quality vaccines reach the American people. And it is why we must ensure that when an adverse event does arise, people can receive the protection and compensation that they need. There is good bipartisan work I know we can do on this front to strengthen the National Vaccine Injury Compensation Program and Countermeasures Injury Compensation Program to make them more efficient. And I hope that we discuss those reforms here today. Today's hearing does have the potential to generate forward-looking policy solutions that improve people's lives. However, it only does so if we approach this topic with care. Because if we don't, I worry that we are opening a Pandora's box that I fear we won't be able to close again. Right now, we are already witnessing an alarming rise in overall vaccine hesitancy, which has been fueled by mis- and disinformation spread online during the last 4 years. And as this mis- and disinformation has festered, immunization rates among Americans have fallen for COVID-19, polio, measles, mumps, and rubella. This should be alarming to us all. We've already seen outbreaks of measles pop up in under-vaccinated communities in the last year, including in Philadelphia and Columbus. And we've already seen an additional 300,000 COVID-19 deaths in the U.S. that could have been prevented if not for a growing distrust in vaccines. I worry that the politicization of medicine, the politicization of science and vaccines will ultimately hurt us all in the end, and that the manufacturing of distrust in public health norms and institutions that we have held true for so long will make us less prepared to combat a future pandemic. For example, Republicans are already 2.4 times more likely than Democrats or independents to believe that COVID-19 vaccines are unsafe. Childhood vaccination rates are already at a historic low. And we are already in the process of undoing decades of progress in overcoming infectious diseases. And unless we handle each opportunity to discuss this with immense care, we are hurtling toward an even more grim future. So I urge for a constructive civil conversation among us all today that focuses on strengthening our current safety and compensation programs, enhancing confidence in our public health institution, and building a brighter, healthier future for us all. And I yield back.
Thank you, Dr. Ruiz. Our witnesses today are Dr. Daniel Jernigan. Dr. Jernigan is the director of the National Center for Emerging and Zoonotic Infectious Diseases at the U.S. Centers for Disease Control and Prevention. Dr. Peter Marks. Dr. Marks is the director of the Center for Biologics Evaluation and Research at the U.S. Food and Drug Administration. Commander Dr. George Reed Grimes. Commander Grimes is the Director of Injury Compensation Programs at the U.S. Health Resources and Services Administration. Pursuant to Committee on Oversight and Accountability rule, the witnesses will please stand and raise their right hands. Do you solemnly swear or affirm that the testimony that you are about to give is the truth, the whole truth, and nothing but the truth, so help you God? Thank you. You may be seated. Let the record show that the witnesses all answered in the affirmative. The Select Subcommittee certainly appreciates you all for being here today, and we truly look forward to your testimony. Let me remind the witnesses that we have read your written statement, and they will appear in full in the hearing record. Please limit your oral statement to 5 minutes. As a reminder, please press the button on the microphone in front of you so that it is on and the members can hear you. When you begin to speak, the light in front of you will turn green. After 4 minutes, the light will turn yellow. When the red light comes on, your 5 minutes has expired, and we would ask that you please wrap up. I now recognize Dr. Marks to give an opening statement.
Chair Wenstrup, Chair Comer, Ranking Member Ruiz, Ranking Member Raskin, and members of the Select Subcommittee. Thank you for the opportunity to testify before you to discuss the Food and Drug Administration's COVID-19 response and ongoing vaccine safety efforts. Vaccines work. We know from clear and compelling evidence that vaccines save the lives of millions of children and adults every year by producing immune responses that prevent diseases such as measles, influenza, and COVID-19. Though they may not provide perfect protection, vaccines can often prevent the most serious consequences of disease, including hospitalization and death. The American public can rest assured that vaccines that are authorized or approved are safe and effective. The vaccine development process and FDA's stringent regulatory and scientific evaluation process and continued safety surveillance ensure that the health benefits of available, approved, and authorized vaccines far outweigh any risks. Regarding COVID-19 vaccines, FDA helped make these critical medical countermeasures available as quickly as possible without compromising our scientific and regulatory standards. During a once-in-a-lifetime pandemic that was a public health emergency, FDA scientists and employees worked around the clock, cooperatively, intensively, and efficiently alongside researchers and manufacturers to minimize the time between the clinical development process, manufacturing scale-up, and the regulatory review process. Hundreds of Americans were dying from COVID-19 daily at this time, and every day we could make vaccines available sooner counted. Every day counted, and we made them count. Between December 2020 and May 2023, over 270 million people received more than 675 million doses of COVID-19 vaccines in the United States, including over 650 million doses of the mRNA vaccines. The COVID-19 vaccines have had a tremendous positive impact over the course of the pandemic globally, ultimately saving millions of lives since their introduction. The vaccines continue to be among the most effective public health measures for preventing the serious consequences of COVID-19. A large part of what has made this public health success possible is the deployment of sophisticated safety monitoring. In fact, COVID vaccines are the most closely monitored vaccines that have ever been rolled out in U.S. history. The safety of the approved and authorized COVID-19 vaccines has been monitored by FDA through both passive and active safety surveillance systems in collaboration with CDC and other governmental and non-governmental partners. FDA also participates in ongoing international pharmacovigilance efforts, and these are in addition to the safety surveillance efforts required of the vaccine manufacturers. These surveillance tools work. In early 2021, just days after passive safety surveillance reporting through the Vaccine Adverse Events Reporting System detected that 6 out of more than 6 million patients who had received the Janssen COVID-19 vaccine had developed a rare blood clotting disorder, CDC and FDA recommended pausing the use of that vaccine until the risk could be further evaluated. Another example is the detection of myocarditis that occurred primarily in younger males following the use of COVID-19 vaccines, which led FDA to modify labeling and CDC to provide advice on the mRNA COVID vaccines to healthcare providers about how to reduce this risk. Vaccines are one of the most highly effective public health measures, and they're responsible for saving millions of lives every year. The benefits of available, approved, and authorized vaccines in the United States, when used appropriately, continue to far outweigh any risks. Staying up to date on vaccination has been and continues to be the best way to reduce the risk of death and serious illness or hospitalization from various infectious diseases, including COVID-19. Thank you for the opportunity to testify today. I look forward to answering your questions.
I now recognize Dr. Jernigan to give an opening statement.
Thank you. So Chairman Wenstrup, Chair Comer, Ranking Member Ruiz, Ranking Member Raskin, and distinguished members of the subcommittee, it is an honor to appear before you today to discuss CDC's ongoing work to monitor the safety and effectiveness of vaccines. I serve as the director of the National Center for Emerging and Zoonotic Infectious Diseases at CDC, which includes CDC's Immunization Safety Office. CDC works to protect against public health threats through prevention, detection, and response, and vaccines are a cornerstone of that work. They have played a leading role in eradicating smallpox, eliminating wild polio virus from the United States, and averting millions of illnesses and deaths from childhood vaccine-preventable diseases. During the COVID-19 public health emergency, over 676 million doses of COVID-19 vaccines were administered in the U.S., which are estimated to have prevented millions of hospitalizations and deaths. These public health successes have been made possible by a shared commitment to ensuring vaccines are safe. As such, vaccine safety monitoring is a top priority for CDC, and we collaborate closely with FDA and other partners. We utilize multiple data systems in a complementary and layered approach to detect possible safety signals, investigate them rigorously, and act promptly when appropriate. The Vaccine Adverse Event Reporting System, or VAERS, is a system where individuals, healthcare providers, and manufacturers can report adverse events following vaccination that may need to be investigated further. VAERS is not designed to determine if a vaccine caused a reported event. Rather, it is an early warning system where we evaluate reports of serious adverse events and use complementary systems to further analyze potential safety concerns. These other systems include the Vaccine Safety Data Link, which uses electronic health records for robust analysis, and the Clinical Immunization Safety Assessment Project, or CISA, which offers consultation to providers on patient adverse events. During the COVID-19 response, CDC also established vSafe, a smartphone app where individuals can report health impacts after vaccination. We also established a COVID-19 vaccine pregnancy registry to monitor pregnancy and infant outcomes over time following vaccination. CDC is committed to transparency and regularly shares information on vaccine safety with our federal and state partners. And in addition, there have been more than 30 public meetings of the Advisory Committee on Immunization Practices, or ACIP, featuring research on COVID-19 vaccine safety and effectiveness. This approach to safety monitoring works. I'll share two examples with you and underscore Dr. Marks's comments. The first is during the first 6 weeks that the J&J vaccine was authorized for use, CDC identified 6 cases of a very rare but life-threatening blood clot through VAERS. When additional review identified a causal relationship between the J&J vaccine and the blood clot, CDC and FDA acted within days to quickly inform clinicians and the public, convened an emergency meeting of the Advisory Committee on Immunization Practices, and recommended a pause in administration of the J&J vaccine. Further investigation led to preferential recommendation for mRNA COVID vaccines over J&J, and currently the J&J vaccine is not available in the United States. The second example is myocarditis. In April 2021, CDC observed higher reports of myocarditis following mRNA COVID-19 vaccination, particularly in young men through the VAERS system. After confirming these events using the Vaccine Safety Data Link, CDC quickly updated clinical considerations while continuing to recommend COVID-19 vaccination. Further research has shown that the risk of myocarditis is substantially lower following vaccination than following infection. As these examples show, vaccine safety monitoring by CDC and our partners is rigorous and transparent. The data continues to show that staying up to date on COVID-19 vaccines is an effective and safe way to prevent severe illness, hospitalizations, and death. The development and administration of COVID-19 vaccines is a remarkable scientific achievement. After the most robust and comprehensive safety monitoring in our history, the science shows that we should all have confidence that COVID-19 vaccines are both safe and effective. I appreciate the opportunity to discuss CDC's vaccine safety efforts and look forward to your questions.